To say thank you. Okay, I just want to say thank you to everybody for joining, both audience and our panelists in that. Just to give you a sort of background, a little bit of background. The Ottawa Health Coalition, it's a nonpartisan volunteer-based group of individuals and community-based organizations. As a local chapter of the Ontario Health Coalition, we advocate for improvements to our universal public health care system. This includes providing our members and the community at large with more information on public health care and to engage them in public policy. Our public hospitals are in an unprecedented crisis. It's nasty. The Ford government has done virtually nothing to help them, and instead they've basically funneled millions of dollars into for-profit corporations to privatize our public hospital services. This evening's emergency town hall is the beginning of a province-wide campaign to force the Ford government to take real action to resolve the staffing crisis and stop the privatization of our hospital services. Due to limited capacity, the session will be in English. However, with special thanks to Louise Langteau of the Cornwall Health Coalition, she'll provide French translation during the question and answer time period. We would like to thank the Ontario Health Coalition for all of the assistance they've provided, because without them, we wouldn't have the technology to be able to reach out and participate within our local communities the way that we do. The plan for tonight, the plan being the operative word here, is Catherine Matthews, who is our Ottawa Health Coalition treasurer. She's going to open up with a statement of respect and the land acknowledgement. Melissa Conrad, who is an interim co-chair of the Ottawa Health Coalition. She's a medical laboratory technician at the Eastern Ontario Regional Laboratory Association and Region 4. And she's regional vice president, VP for the Ontario Public Service Employees Union as well. Joining us tonight for this will be Karen McCoy. She's the local coordinator and bargaining unit president of the Ontario Nurses Association, Local 214 at CHEO, Children's Hospital. There is Dr. Atul Kapoor, emergency room doctor at the Ottawa Civic Hospital. He's going to come on just a little bit later, so we'll see him when he comes on. And also Michael Hurley, who is the president of the Ontario Council of Ottawa Hospital Unions for Canadian Union of Public Employees. We also have Natalie Mayra, who's the executive director of the Ontario Health Coalition. She's just presently doing something else right now, and she will join us in a little bit as well. We are being recorded, and throughout the evening, it would be best if you could please put your questions in the chat, and we'll do our best to address them as soon as we can, as soon as we hear from all of the panelists. We'd like to hear from all the panelists first. If there are any media in attendance, can you please identify yourself in the chat? That would be great. Thanks very much. And following the question and answer, we will then talk about what we can do to stop privatization and win improvements in public care. We're going to try and wrap up by 8:30, but we have no plans to go beyond 9 o'clock, or at least that's our hopes and dreams. Catherine, if you could please go ahead with the statement of respect and land acknowledgement, that would be great. Thank you.
Thank you, Betty. Welcome, everyone. I'm going to start with our land acknowledgement. We are settlers from all over the world who, over many centuries, have benefited greatly from living on land stolen from the Algonquin and Anishinaabe Nation, who are the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory. As visitors on this land, we have an important responsibility to acknowledge the grounds on which we are privileged to gather in the pursuit of community building and social action. We believe it is important to recognize the Anishinaabe people for their care of and teachings about the earth and our relations to it, and to honor those teachings through our relationships here and in the broader community. May we move forward with our Indigenous brothers and sisters in the spirit of partnership, collaboration, and reconciliation. We also have a statement of respect which we share before every meeting. Whenever the Ottawa Health Coalition meets, we welcome all peoples, including First Nations, Métis, and Inuit. We will not accept any unwelcoming words, actions, or behaviors against our members or guests. We respect the diversity of all persons, regardless of varying abilities, age, gender, sexual orientation, language, color, ethno-racial identity, religion, or faith. In our diversity, we build community and common cause. Thank you. So I'll move things to Melissa.
Thank you so much, Catherine, and thank you all for coming. I would also like to give a special welcome to MPP Chandra Pasma, who is on the call today. I know that you're very busy, and I know that healthcare is something that you advocate very strongly for. So thank you on behalf of all of us for making time tonight for coming out. Over the term of the current government, we've watched Premier Ford systematically break our healthcare system through underfunding. Ontario has the lowest funded healthcare in all of Canada, and that has remained over the course of his term, even though his platform was heavy on investing in healthcare. The lack of healthcare recruitment plan that we have in colleges and universities, and the inability to retain staff with Bill 124, which has capped our wages at 1% for 3 years for all frontline workers. And most recently, Bill 7, forcing healthcare staff to send our loved ones out of hospital beds and into long-term care against their will. That hasn't quite started yet, but for the most part, that's the anticipation. Staffing shortages have left frontline workers doing double shifts, and or working many consecutive days in a row, working 10 and 12-hour shifts beyond what is a healthy amount, causing burnout, mental health concerns, and high amounts of sick leave across the entire province. Underfunding and lack of capacity has created emergency room closures, as we've all heard in the media, especially all around Ottawa. It is hitting every single hospital. OR closures and hospitals over capacity. Most recently, we've heard day after day after day about CHEO, the Ottawa Hospital, Queens by Carleton being over capacity and really perpetuating hallway medicine, if you will. CHEO recently had to move any children 16 and over to adult hospitals to make room for pediatric patients under the age of 16. We've also heard of CHEO having emergency room waits of up to 18 hours. Parents are waiting with their children due to respiratory illness right now. And in many cases, we've heard parents say that they're being told there is only one physician on for an entire overnight shift, causing these delays. The goal of this government, they're succeeding quite successfully currently to cripple our healthcare system, to really just demonstrate to the public that in their view, the only way to fix this is privatizing our healthcare, which they have been doing slowly. And as we will hear tonight, that isn't the only way, and it is far from the best way to keep our public healthcare system intact and functioning. And I could sit here and talk about this all night, but we have some amazing speakers lined up. And we're going to start off tonight with Karen McCoy. She's worked as a registered nurse for 25 years at the Children's Hospital of Eastern Ontario, and in the last 10 years in the emergency department. Karen is currently the bargaining unit president and local coordinator for the Ontario Nurses Association for Local 214 at CHEO. Karen has shared that while she lives and works in Ottawa, her heart is in Nova Scotia, and she is a proud Navy brat. So please welcome Karen to speak on her experiences as a nurse and in the ER at CHEO.
Thank you for that. I always like that as a little icebreaker, everyone who knows the Navy brats across the country. So yes, as you had said and eloquently had said, like CHEO has been in the news. It's not it's everybody knows that we've had unprecedented volumes. We've had to create a new inpatient unit in the emergency, sort of off to the side of the emergency department to house extra patients, that there's no room at the inn basically to go upstairs. So they're keeping up to, 20 patients in that department that otherwise would be on the inpatient unit. It was also in the news not too long ago about having to open up a second intensive care unit to take care of these very small children. It's been well documented. And so some of the challenges that are faced by these healthcare workers and nurses is the sheer volume of patients and the sheer volume of strain and having to care. The nurses and healthcare professionals and physicians at CHEO will always go above and beyond to take care of all of these children. But all of these sort of happen. I like to say it's like a story. Like this happened before the pandemic. You could have read it, pretty much predicted what was going to happen. I mean, there was a cumulative effect way before where the wait times were increasing. And it wasn't just like wait times in emerge, it was wait times for just general children's needs. When I was looking some of the impacts, the data that I was pulling, it was saying before the pandemic, there was over 30,000 children and youth who were waiting for community-based rehabilitation services. And these are growing, the wait lists are growing. And because they're waiting for so long, they will require acute care before they're able to be seen in the community because of the wait. And so that adds to your strain, basically, on the emergency department. We've had surgeries were canceled during the pandemic. There was some investments to increase the surgeries as we move forward. But obviously with, the respiratory season hitting, they've had to now delay more surgeries again because of having to open up a second pediatric intensive care unit. And you never want to make a child wait. Prior to the pandemic, children were waiting longer wait times than adults. The other challenges that we talk about is that there is no meaningful recruitment and retention plan from this government. From the Canadian Institute for Health Information, Ontario is the worst country when it comes, worst in the country, not worst country, worst in the country when it comes to RNs per capita. Across Canada, there's like 830 RNs per 100,000 people. But in Ontario, we only have 668 for 100,000 people. That means the Canadian average, we need to hire over 25,000 RNs immediately. And this government does refuse to work with healthcare professionals to invest in the meaningful recruitment. Therefore, it's leaving our system very understaffed with no relief in sight. I can't strongly say enough that private healthcare will take away from the public care by pulling resources and staff from the public system. Our public healthcare system has been built up over generations and belongs to all of us. Ontario deserves better. Children deserve better from this government. I didn't take my 10 minutes because really it's been in the news. Like, I don't know what else, you can just imagine. All I can say is that, they're doing their best. And the biggest thing I say is that this isn't a crisis and it's not sustainable, and it's like I told MPP John Fraser, it's like an elastic band. You stretch it too much, it will eventually just break.
Yeah.
Thank you.
Thank you so much, Karen. Yeah, it's been all over the news. And, before the pandemic, during the pandemic, now, I mean, it's very consistent with what you're saying. If anyone does have any questions for Karen, please send them directly to me, or any questions at all. I will be reading them out and asking for responses from our speakers when they're finished. Is Dr. Kapoor on the call yet? We are a little bit ahead of schedule, so he may not be here quite yet. I don't see him. So we are going to welcome Michael Hurley as our next guest speaker tonight. He's going to speak on provincial government policy and how it ties into the staffing crisis and privatization. Michael is the president of the Ontario Council of Hospital Unions, with CUPE, which represents 34,000 hospitals and long-term care staff across Ontario. Michael was a leader in the formation of the Ontario Council of Hospitals Union. After university, he dedicated his life to building the power of the workers, often at great personal sacrifice. He led a hospital strike in the 1980s when workers did not have the right to strike, and was fired and convicted of contempt of court. His courage has never faltered. Ontario Council of Hospitals Union regularly puts outreach reports, puts out research reports, organizes rallies, supports the movement of public health care, and to stop privatization, and many social justice causes. Michael is a community hero. Please welcome Michael Hurley to speak.
Thank you so much. What a generous introduction. I just wanted to say thank you so much. It's such a privilege to be invited to speak to the Ottawa Health Coalition, because the Ottawa Health Coalition is one of the outstanding activist coalitions in Ontario and leading the country in terms of the example that you set, in terms of mobilizing your community. And it's a real privilege to be with you tonight. None of us by ourselves is very powerful, but when we assemble and when we commit to each other, when we organize the people that we know and our coworkers, we become powerful because we are the majority dependent upon this system. And I would just say on a personal note, I've spent a couple of months in hospital over the summer, with a great impact actually personally, but the healthcare system is functioning as well as it can, but it can't sustain itself without additional staff. People are trying to keep it together, but it's not possible. They just are going to wear right out, and that's really our challenge. There's a direct link between the current staffing crisis in our hospitals and the fact that Ontario is last in Canada and second last in the Organization of Economic Cooperation and Development in terms of the ratio of staff and hospital beds to population. In the last 30 years, as you know, Ontario closed 25,000 acute care hospital beds, even as its population aged and grew. And as our population continues to grow and age, the capacity crisis just deepens. As the pressures of population growth and aging are compounded by unpredictable surge events like a pandemic, now worsened by flu and RSV, the cracks in our hospital system become more and more apparent. The Minister of Health would have you believe that everything that is happening now on the Ontario hospital system is planned. The multiple closures of the Perth ER, the closure of the birthing services at that hospital, the enormous pressures at CHEO and pediatric care, the closures of 80 ERs this summer across Ontario, including in Ottawa at the Montfort, at Alexandria, at Kemptville, at Kingston, Winchester, and many other Eastern Ontario communities, all normal, all planned. Well, I think it's a train wreck, and it's probably deliberate. 260,000 people are supposed to be working in Ontario hospitals, but we're 47,000 staff short, and another 15% of the staff complement leave every year. Workloads for those who remain are just impossible. Our hospitals regularly operate at more than 100% occupancy, with a staffing complement that isn't large enough to cover 80% of the patients properly. And imagine, if you can, children's hospitals operating at 135% capacity, as many are now. It isn't unique. For the hospital staff, there's constant pressure to work additional shifts and overtime, to work sick and injured. There's a persistent feeling that the care that is being delivered just isn't good enough. There isn't enough time to spend providing care to each patient. Care is often reduced to medications and treatments because that's all there is time for. Over time, this takes a very heavy toll on morale. The hospital workforce is exhausted after 3 years of fighting on the front lines of the pandemic. The hospital workforce is demoralized largely because the Ford government, while lavishing praise on its healthcare workforce for its heroic contribution, passed Bill 124 in 2019, which had the effect of limiting ability to bargain on wages for a 3-year period just as inflation began to climb, leaving hospital staff and other healthcare and public sector workers to take real wage cuts of 10% against inflation. And wages, which were already low, artificially suppressed by interest arbitration, which, by the way, is very generous to male-dominated emergency responders like police and fire, has been remarkably frugal with respect to the female-dominated professions in healthcare. That's why 87% of the nurses that CUPE represents indicated in a poll we did recently they would change their plans to leave nursing if they could receive a real wage increase. In any other professions that had shortages, and there are shortages in just about every classification in Ontario hospitals, employers would just pay more to attract new workers and to retain the ones they have now. But that isn't happening. Bill 124 prevents that. Staff are leaving as a result, looking for better paying or less stressful work. For us to retain hospital staff, we have to bring the average staff to patient ratio in Ontario from last in Canada to the Canadian average. We estimate that would take an investment of $2 billion. In addition, we need to do these things. Scrap Bill 124, of course, provide incentives to people who have retired or otherwise left nursing and other professions to return to work, while the training programs that turn out nurses in 2 and 4 years are getting off the ground. Provide additional incentives to staff to work overtime, to work weekends, to work nights, and add clerical staff to take administrative duties from nurses so they can focus on patient care more. Stopping the hemorrhaging of hospital staff by giving them hope that workloads and the quality of patient care will improve significantly and that they will be fairly treated is a starting point to dealing with the 15% attrition rate. But we know that the Ford government plans to invest substantially to pull diagnostics and surgeries out of public hospitals and into private clinics and private hospitals. Even though the death rates in private clinics and private hospitals are higher, even though the outcomes are less successful for patients, even though the costs are much higher, opening a market by commercializing hospital surgeries and other procedures is a priority for the Ford government, one that they are ideologically committed to. They've been clear about that. And that means the battle on this issue will go right to the next election. It's in this context that the deliberate understaffing in our hospitals, the degraded compensation for the workforce, the impossible workloads should be viewed. It is planned. It is deliberate. It's meant to run the system into the ground. Are these things not accidents, but deliberately planned to create a backlog of surgeries and other procedures and open the door to privatization? I believe so. The Minister of Health tries to quiet critics by suggesting that the closure of 80 community ERs over the summer and now the huge pressures at pediatric hospitals are not crises, but planned events. On the one hand, we imagine that surely no one would plan such system failures. On the other hand, we know that this government is using the current weakness of the public hospital system against it to privatize the backlog of surgeries and diagnostics. And the fact that the Minister of Health and the Ford government has never tabled a plan to deal with retention, to deal with the hospital staffing crisis, but simply denies it and deals with infrastructure tells you a lot of what you need to know in this context. We know that this can be a road from which there may be no turning back once we go down it. And so we assemble here today, resolved to defend our public system from the latest attempt to privatize it. And we do that with a sense of history that reminds us that we stopped the privatization together, many of the people on this call tonight, of cancer care and of ambulance services under the Mike Harris government in the 1990s by mobilizing communities like Ottawa, which was decisive and played a key role. We can do it. We did it then. We can do it again. An aging and growing population is still a population deserving of quality care. A tired and demoralized workforce can be given hope and renewed energy. A hospital system pruned almost to the point of collapse can be brought back to vibrancy. It's vital that we set our expectations for this government, but as importantly, that we set out our expectations for the people of Ontario. It's vital that we leave here tonight committed, each according to our capacity, to do what we can to battle to preserve our public hospital system in this province from privatization. I want you to know that you can count on the people who work in hospitals to be with you on the front lines, fighting alongside you as we push these privatization plans back, as we surely will. Thank you so much for the opportunity to speak tonight.
Thank you so much, Michael. I always appreciate listening to you and the passion behind why you do what you do and the experience that you have. So thank you for that. We are still waiting for our next two speakers, but I do have a lot of questions that have come in. So I am going to start with one for Karen. It's from Erica, and it says, what are examples of how the government has privatized our healthcare system already? And I know that I have some examples, but I'm curious to hear what you've seen firsthand, if anything.
What I've seen firsthand, I work at a hospital, so I don't know what they've done in the community.
Okay.
I'm trying to think. Yeah, I was going to say the vaccination centers. Yeah, so the vaccination centers that we were doing, things like that, are some of the privatization.
Yeah, definitely the vaccination centers. And for some people that don't know, I'll just add a little bit to that. In the vaccination centers, what they did was they pulled people from hospitals that weren't necessarily nurses or doctors. They had physiotherapists giving vaccines. They had, some other healthcare professions that don't traditionally give injections or needles. They were training them up to give vaccines because they needed people. Which a lot of people didn't realize when they were going into vaccination clinics. But I know that as far as I'm a lab tech at the Ottawa Hospital, and I can tell you that for us, they have privatized a lot of our testing. They've also already made a lot of the lab tests that you walk in to get for profit. You have to pay for them. They're not covered. Things like urinary pregnancy tests are no longer covered. If you come in to get those done, you have to pay for them. There's a whole list. We have a whole binder of tests that you now have to pay for that used to be covered that aren't covered. So it's happening slowly. They have also given out private surgery licenses for clinics to open. Most of them aren't open yet, but they are in the works. There's quite a few things, and I know Natalie has quite a bit more to speak on that. So when she does come in, she will be able to add to that. But it's happening rapidly. MRIs that you have the option to pay for if you have the money, if you don't want to wait for the public MRIs, things of that nature, they're already here. They're already happening, and that list is rapidly growing. We also have a lot of agency nurses, which I know Karen has probably at least heard of, but I know that we have a lot of agency nurses, areas that can't keep nurses, a lot of our correctional facilities that nurses aren't staying in. We have a lot more paid for agency nurses coming in to do that work.
Yes, we don't have any agency nurses at CHEO.
Right. Yeah. So that's happening, and it's costing taxpayers a lot more money than you realize, because it could cost 2 or 3 times for an agency nurse versus a full-time or part-time permanent staff at a facility. Michael, I don't know if you have anything that you want to add to that. I know you're very experienced in some of these things, so I don't want to.
No, I thought you were very thorough.
Okay. Thank you. So we also have a few questions about unions that I am going to hold off on because we do have some action items coming at the end from Natalie. Someone else put in the chat, ophthalmology is a good example of privatization, and something that you have to pay for. We have, yeah, I love the conversation that's happening. People are sending me all kinds of examples of privatization. We have so many healthcare workers on this town hall tonight. So they're saying outpatient dialysis services is something that's also being privatized.
I'm just going to interject. What about the plasma collection centers?
Yeah, that's a big one. The plasma collection centers that are now being privatized, and the plasma is being shipped out to other countries. It's not even staying in Canada. For anyone, I am going to put a little plug in here as the moderator. We do have an action happening December 1st on Alta Vista Road in front of Canadian Blood Services for exactly this, to try to bring attention to the privatization of the plasma services. So if anyone is interested, we can get some information out to you as well, because that's one that they're trying to slip under the radar and not bring a lot of attention to. So we are going to be bringing attention to that next week. Okay, so I don't see Natalie or Dr. Kapoor back in here yet, so we will keep going with questions. So we have here, we had a specific question for Michael that says, is it cost effective to push healthcare workers to do overtime?
Well, I mean, in the long term, perhaps not. But in terms of, what we're going to do immediately, so far from the Ford government, we have announcements of training programs, as you know, like expanded nursing programs, for example. But to produce the first graduates, we're years away from that. So what do we do in the interim? There are 15,000 licensed nurses, for example, who are not working in hospitals. We could try to recruit them back, but we'll still have a significant shortfall of nurses and other healthcare workers. So incentivizing people to work more, to work extra days, to work nights, to work overtime is one of the limited options. And because people's real incomes are falling, it is attractive to people. When the hospitals introduced some incentives over the summer to deal with the vacation problem, there was pickup on that. How long you can continue that with a workforce that's as tired as it is, remains to be seen. Your point is an excellent one, but the range of options is limited. To some extent, that's just one of a number of things that could be done. I think it's also important, the Canadian Federation of Nurses Unions has called for, ward clerks and other people who handle some of the administrative issues, or used to have been eliminated, and that sends family members sometimes unnecessarily back to nurses, for example, and it also burdens them with administrative details which distract them from their jobs. I think we need to be thinking about what are all of the things that we could be doing. And what's particularly disturbing, of course, is the unions, the 5 unions, ONA, OPSU, CUPE, SEIU, Unifor, we wrote the Premier in July asking for a meeting, setting out a number of these suggestions, and haven't had a response to our letter, let alone a meeting, and let alone a plan. And that is really distressing, because it should be obvious to anybody that the system desperately needs a plan on the health human resource side. These are just some ideas.
Thank you, Michael. So Natalie has joined us. She is going to be our next speaker. Natalie's going to provide an overall picture of the threat that we are facing to our public healthcare system and an explanation of really what's at stake. Natalie has been the executive director of the Ontario Health Coalition for 22 years and has dedicated her life to social justice issues. The Ontario Health Coalition is one of the largest public interest groups on healthcare in the province, representing more than 750,000 Ontarians in its network of more than 500 member organizations and more than 50 local chapters. Natalie has conducted countless province-wide tours, organized protests and lobby days, written and published hundreds of reports about healthcare policy changes, conducted social media campaigns, and developed public education programs in her tireless defense of our public healthcare system. Through her guidance and dedication, the Ontario Health Coalition has played a major role in successfully pushing back on the continuous attacks on our healthcare system. Welcome, Natalie.
Thank you, Melissa, and thanks to the Ottawa Health Coalition. Michael and Karen, thank you very, very much. Lovely to see you, Louise, as well, and all of you. Really happy to see that there are more than 100 of you here from Ottawa to join us today. You know, I was just actually, I had to do another town hall meeting on the emergency and long-term care, and it's sort of hard, I think, to overstate the crisis that we're seeing in healthcare. It's really like nothing we've ever seen before. And what's staggering to me is how little the Ford government is doing about it. Like, they really are intransigent. They do not want to spend the money to provide the services. I'm sure Michael probably went through this, but Ontario funds our hospitals at the lowest rate in the country. Did you talk about this already, Michael? And a little bit? Okay. And I'm sure you said we have the fewest hospital beds left per person. I think this matters. I don't think Ontarians realized that for decades now, it's entrenched in our Ministry of Health, this policy of dehospitalization, that we're going to downsize the public hospitals and push people out ever sicker, to the point that like no one else has. You know, no one else in Canada has done it. Our peer nations in Europe have double the number of hospital beds that we do per person. Like, it's the crisis that we're seeing now of undercapacity is because we had no we didn't have enough capacity in normal years. In a flu year, we'd have hospital CEOs telling people not to go to their own emergency departments, right? Pandemic hits and we just have nothing. We burned through the resilience in the healthcare system now, and the staff are completely tapped out. And yet, in this context, in which the healthcare staff tell us they do their shift and they go and they cry in their cars. They cry in their cars on the way home. They go home and they think about what mistake they might have made that day that, you know, risked a patient's life or their health because they're rushing all the time. You know, they go home or they go on vacation and they're called in endlessly to cover shifts of their colleagues who are off sick because of COVID or other things, or because they're just permanently short-staffed. There's never a break from the pressure for them. On the patient side, people literally stacked in sun lounges and closets, in bathrooms, in every space that you could find in a hospital. In the children's hospital, you know, converting cafeterias to ICUs to take care of desperately ill infants. You know, this is what we're looking at in Ontario in 2022, a consequence, yes, of a pandemic, but a consequence fundamentally of government policy that makes no sense, that has no grounding in any kind of evidence or reason. It is driven by privatizing. Everything that's moved out of public hospitals is privatized, everything. Long-term care, home care, community care, it's all privatized. It's driven by cutting budgets and trying to save money in order to deliver tax cuts that mainly benefit the wealthy and corporations. That's what it's driven by. These are political choices. And now the government has made a choice. I cannot believe that after 3 years of risking your lives, healthcare workers, for us, that they will not even remove wage caps. I mean, what? What are we even looking at? You know, the most minor thing that they could do to solve the staffing crisis, they won't do. You know, let alone the other things, you know, pay the licensing fees for the retired nurses and health professionals who've retired out, bring them back, guarantee workloads and patient ratios so that people aren't getting injured at work in enormous rates, guarantee hours so people have some control over their schedules, you know, improve the wages and working conditions so that people will come back and will provide the care. Do a mass recruitment strategy like we saw in Quebec after the first wave of the pandemic. They successfully recruited all in one go, you know, almost 10,000 staff to bring into the system because staffing shortages beget staffing shortages. Because the more short you are, the more people leave because they can't handle it anymore. You know, instead, the government has chosen to do practically nothing. They announce, you know, the media is complaining to me that they're saying to them that the same talking point month after month after month, we're bringing in 6,000 staff, which they may or may not be doing. I mean, no one can ever track that. They're using the private colleges, the for-profit colleges, like all of this is ideological, right? Rather than doing what the Quebec government did and doing, you know, putting their shoulder to the wheel as government, recruiting, paying people for training and getting them in when they could do that. But for the nurses, as Michael says, it takes longer. So we're going to have to bring them back. There's no other choice. And in order to attract them back, we need to meet the working conditions that they need. And that means also meeting those conditions for the staff who are on the floors now. And there is no other way around this situation. Eventually, it's going to have to happen. The question is how many people, you know, will lose their lives? How many people will lose their health, staff and patients, while we wait for that to happen? Well, we don't want to wait any longer. If we don't protest this, what do we protest? You know, what is it that we take issue with significantly enough to make it visible, to resist it? You know, they're doing this because they want to privatize the hospitals at the same time as they're doing absolutely nothing to deal with a crisis that is a function, the part that they can control, that's a function of public policy in the public hospitals. They doubled the funding for the private clinics in the last quarter of the last fiscal year. Michael, I don't know if you covered this, sorry. So that's the months January, February, March of last year. They literally doubled the funding for the private clinics while they were, you know, telling the media that they categorically were not expanding the private clinics. So not only did they lie, but they're shifting public resources, that's our money, over to the for-profit companies to privatize our hospital services. They want to dismantle our public services, take the parts of the hospital that are profitable, the surgeries, the fast-track surgeries, the diagnostics where these for-profit companies can take money, take them all out, leave the expensive, you know, not profitable services left for the public system to have to do with less staff and less resources to do them. It's an asinine idea. It's the destruction of our public hospitals that our communities have spent literally 100 years building up and trying to get good services into. It goes against everything that communities have worked for in this province for decades. And we're asking people, will you join us to stop this? We can actually stop this. Every time we've fought back, we've won in stopping privatization of our hospitals, but we have to fight it. And there is no one else to do it. There's no mythical other person who's going to make it happen. So we're asking you, will you join us in that? Will you help pour on the pressure, make it politically impossible for the Ford government to do this? I just want to say this, you know, what's at stake? I was talking with a mom of a child who's profoundly disabled. And she needs hospital care, you know, and this is a mom who takes care of her kid at home. Like, and this child needs help breathing, needs help with, you know, all of the functions of daily living. The mom is an expert, you know, she knows when her kid needs the emergency department. She went into a children's hospital a couple of weeks ago because her child was in emergency, and she was sent home. They weren't able to provide care for her because there's no space. They don't have any space, and because the mom has some equipment at home, she's had to resuscitate her child at home alone without any nurse present. You know, that's what is going on. This is what's at stake, and we cannot say that this is acceptable in, you know, Ontario, Canada, you know, in 2022, it isn't. And we can win. I just want to leave you with this. A long time ago, do some of you remember Ralph Klein? He was the premier of Alberta. Some people are
Yeah.
nodding. This is way back. So when governments really started the major push to cut funding for public services and privatize it all, this was like the 1995 federal budget, and provincially there was the Mike Harris government in Ontario and the Klein government in Alberta. And as a big show of, you know, machismo, they imploded the Calgary hospital. Like, they literally imploded it. They were gonna, you know, bring their radical change. They were really informed by the American right wing, you know, and bring their radical change, and Margaret Thatcher to healthcare and privatize and so on. And they got, you know, very seriously pushed back. In Alberta, the patients took to the roads. They filled the galleries in the legislature. There were people, I remember, hanging from the banisters in the gallery in the legislature. Shirley Douglas, Tommy Douglas's daughter, described cars you could see, because you can see down the prairie, lined up down the prairie for miles to get into the legislature to protest what they were doing. And in the end, Ralph Klein called public health care the electric third rail of Canadian politics. You know, on a train, you've got the two rails that the train goes down, and then the electrified rail in between, and you dare not touch it because you'll get electrocuted. So I loved that. I thought, yeah, you know, let them be afraid of us. Our job is to electrify the third rail. Let them be afraid to privatize our cherished public health care. Thank you very much.
Thank you so much, Natalie. So we are going to go to Q&A now. I have lots of questions in the chat. I'm going to put them out there, and any of the panelists are welcome to respond. Helen says, unions working together made the Ford government rethink the way they were treating educational assistants. What do we need to do to get the same government to rethink healthcare decisions? And what can I do as a regular citizen?
Should we take a few questions at once? Because we're going to go into the action plan in a minute, and that's kind of a perfect segue into the action plan. Does that work?
Yeah, for sure. I think the next question goes along with this one too. It says, the question really is about what is the immediate response? What is something we can do immediately for the crisis, and what is something long-term? And Natalie, I know you have some responses for that as well in the action plan. We have lots of comments about privatization, PSWs, agency nurses. People are really sharing their experiences with that, and finding family physicians as well, which we know is an ongoing issue and part of the crisis in Ontario. Someone's asking about concierge health services, which is also part of privatization, where health services come to your home. Also accurate. I'm not sure, Natalie, if you have anything to say about that comment.
I don't know much about, I mean, like privatized virtual care, but I'm not sure about concierge health. Is that just a fancy name for privatized home care?
Yeah.
Okay. Yeah. So I mean, Like, obviously, if it's, you pay for it, you get it, and everyone else can't. I mean, as it is for a PSW in home care, I'm gonna guess in Ottawa, it's somewhere around $28 an hour, something like that, double that for a nurse. I mean, most people can't afford that. So if it's more expensive than that, it's just beyond people's means. That's the whole reason we have a public healthcare system in the first place, so that people, when they're sick and they're dying, that they're not, faced with those kinds of financial destruction.
Yeah, and that's a big part of what we're trying to accomplish here. Hector has an interesting question. It says, recent immigrants and new Canadians may not have been familiar with the healthcare system in a time when it was better funded. What are good arguments in favor of increased public spending on healthcare in a way that would appeal to their specific needs?
Michael?
Well, I mean, we're facing this increase in healthcare spending due to demographic pressures, and the demographic pressures aren't permanent; they're temporary. I mean, they're over they're over decades, right? But they will subside, just like the baby boom generation relaxed its need for elementary schools and secondary schools. There will be a fall off eventually in the demand around healthcare. The moral question is, are we going to sustain everyone who requires high quality healthcare through this period, even though it's costly? And I think it's immoral to say, no, we won't. That's too expensive. We'd rather deliver tax cuts to a sliver of the population than quality healthcare to everyone.
Mm-hmm.
And of course, the whole question of the right of access of, people who are visiting here or are not, landed immigrants or Canadian citizens is another whole question, and another moral question for society. Like, I don't know how we turn our backs on people who are sick and struggling, and bill them out, unpayable amounts of money. I don't know how we do that. But I think these are the questions. I don't know whether I answered the question or not. Yeah.
I also, if I can add, Randy Robinson from the Canadian Centre for Policy Alternatives, he likes to ask people, do you know when were we the wealthiest ever in our history as a country? Does anyone know? Or to have a guess? You can just call it out. Or maybe put it in the chat. I don't know if everyone's
Now?
What?
No.
Now?
Mhm.
Yeah, like most people would say like the 1960s or something like that. But the truth is, it was 2 years ago. And we're very close to that now. We're not on like a permanent, some kind of permanent downslide. I mean, we're talking about being one of the wealthiest nations on earth at one of the wealthiest times in our history, in the history of the world, actually. As if we can't afford to provide healthcare for each other. We absolutely can. It's not a question of affordability. It's a question of who we choose to give the money to. Even within healthcare, who are we choosing to give the money to? Like, are we going to give it to these for-profit clinics that then turn around and bill OHIP and charge the patient $2,000 on top for their cataract surgery, and then take that money away for themselves and don't actually put it into improving care or anything like that? No, so within the system, the money should go to care. But in addition to that, we have the room, we have the space as a society to provide for each other. We built public health care in years in which we had nowhere near the level of wealth that we have now.
Yeah, thank you, Natalie, and thank you, Michael. I'm going to put 2 more questions together here. So there was a question here, is there any legal recourse to hold the Ford government accountable? Is first part of the question. And the second part of the question is there anything that hospitals can do to better utilize the staff that they have? For example, the Montfort hired paramedics to care for patients who have just arrived by ambulance while awaiting triage. It's a pilot project, and it has just been extended.
Like, I wonder if Karen or Rachel or you, Melissa or Michael, wants to, like, could answer that second one, and then I can take the first one if that's good.
Sure. Go ahead, Rachel.
Oh, Eleanor too, yeah.
Yeah.
So it's Eleanor here. When I read and heard about that pilot project in the Montfort, I was really upset because it is going on at the Civic Hospital and has been. I don't know how long, but recently, July the 20th, I experienced it firsthand with a family member. They had 4 beds squeezed into a tiny area, and it was one nurse dedicated to taking those patients to be onto. So that I didn't see how many ambulance service or paramedics left, but it certainly was in place. So Montfort, unless they're doing something much more super care and fast turnaround, but the hospitals, from firsthand experience, is extremely short of staff. You all know that around healthcare and hospitals. I was never so welcome for 8 weeks because I became a central caregiver. Thank goodness we got that out of the Ford government after COVID started. So I was able to assist and care for my family member. The medical, you've said it, it's in dire need of change.
Thank you, Eleanor. Rachel?
So yeah, we've hired paramedics. They're actually hired by TOH, and they're in Emerge, and they're for offload only, so that when the ambulances come in, the paramedics can offload the patients to a paramedic, because we don't have enough nurses in Emerge to be in that offload area anymore. So they're offloaded there and they're cared for, because the ambulance drivers, the paramedics, cannot leave until care is assumed by somebody else of at least equal skill and ability. So that's what's happening. It's not a pilot project at TOH. It's a fact of life now. Because on any given day, just as with Karen and Emerge at CHEO, we're running where we should have 24 staff. We've got 14. So this is another stopgap measure to try and resolve the issue.
Thank you, Rachel. Karen, do you want to add to that?
Yeah, I was just going to say, we don't have the paramedic, that program at CHEO. We do have our own, we do our offload. But when I hear that, I think to myself, it seems odd you're pulling resources from the community, because how many times is it a code 0 in Ottawa to put them in the hospital? Like, it doesn't make sense. How many times people are waiting hours for an ambulance when they could be better service? So I always look at it, you should have the right person in the right place to do the right type of care. That is what we should be striving for, not putting this, having a nurse have, 10 patients or 20 patients. And then, yes, PSWs are great. They do, but we should have them in the right places. And so that's what I just have to say, like the right person for the right care. I've just never understood that whole, let's pull from other areas to assist if we just invest into what we need right now.
Thank you, Karen. Natalie, did you want to talk about the legal side of it?
Yeah, and maybe Michael, like on the hospital front, is there a way to legally challenge, like it may be possible to do something around them privatizing the hospitals, depending on, like, they're it's all very secret, and we have to kind of figure out exactly what they're doing, who's getting the money and for what and so on, because they're, they were doubling the funding for the private clinics, they were actually telling the media categorically that they weren't doing that. Now they've announced that they're going to do it, but they actually are in the process of doing it. So I think, just thinking out loud here, but I think we need to catch up on what they're actually doing and then see if there's any abrogation of any law. But mostly, I think this is going to be like a political question. There is one thing, once they privatize, but this is too late, then the private clinics tend, like we've called every private clinic in the country multiple times, and we've caught them, the majority of them, charging patients for medically needed services, and also upselling all kinds of stuff to them that they don't need without telling them that they don't need it. So the private clinics violate the Canada Health Act, which bars, you are not allowed to charge a patient for medically needed hospital or physician care in Canada. That's what we won when we won public Medicare. So we are going to launch surveys and ask people what they're being charged for. We know in the ophthalmology clinics, the cataract surgery clinics in Ontario, they're charging outrageous prices. They're charging people for cataract surgeries. They're charging for all kinds of add-ons like unnecessary eye measurement tests and so on. This is just to make more money for the operators. And so when we get that information together, and everyone can help with this by putting out the surveys, filling them in yourselves, sharing them with any organization, especially seniors organizations where there might be a lot of people who've gone to get endoscopies and colonoscopies and so on. We collect the evidence, and then we can bring a writ of mandamus, which is a mechanism, a legal mechanism to get the court to order the government to follow their own laws and crack down. The private clinics, their business model is to bill OHIP and bill patients on top. That is how they make their profits. And so, that would sort of cool the climate for them. Other than that, I mean, we just brought a legal challenge today to another bill, Bill 7, which forces the elderly out into long-term care homes, not of their choosing. But there isn't anything clear like that, I don't think. Michael, do you know?
No, but I mean, I think if there is the possibility of any legal challenge, we would mount it, right?
Okay.
Collectively, I mean, we'll go fund me, the unions will kick in, community groups will raise money, like, well, if we've got a shot, we'll do it, right? Yeah.
Great, thank you so much to both of you for that question. Dr. Kapoor has now joined us. So welcome to Dr. Kapoor for joining us, and thank you so much for coming. He is going to speak on how current staffing crisis is affecting patient service in the ER. And I know that we did have quite a few questions around this. Dr. Kapoor is an emergency room physician who works at the Ottawa Hospital Civic Campus. He is a strong advocate for improved patient care. He is the president of Physicians for a Smoke-Free Canada and the past director on the board of the Ontario Medical Association and the Canadian Medical Association, and the former vice chair of the Ottawa Board of Health. So welcome, Dr. Kapoor, and the floor is yours.
Thank you so much, Melissa. And folks, I do apologize for living the stereotype of a doctor showing up late. I was at another meeting, but I really did want to come and share with you and hear your stories and questions as well. I understand you've heard what things are like at CHEO and the dire situation there. In Emerge generally, COVID didn't cause the crisis that you're seeing and that you're hearing about. There were already big fractures in the system. And what COVID did was stress those cracks and burst them wide open and showed that the system couldn't deal with any what we call surge. In medicine, in hospitals, we don't think hospitals should be running at 100% regularly. The ideal is that the hospital runs at about 85% occupancy. And that is to allow what we call surge capacity, because patients don't come in like widgets on a line, and we need to be ready to deal with patients coming in a burst, or with things like the seasonal flu that we used to recall. Unfortunately, a lot of economists and convinced governments that, you know, you need to be, if you're running at 85% occupancy, you're wasting money, as if we were a hotel. And so we've, for years now, had troubles, because when you do go at overflow, they come to the emergency department. I work at the Civic and the General both, but I'll use one of them as an example. In the emergency, we have 40 beds. Half of them are monitored, the other half are not. And then we have a fast track area. These days, 15 to 20 at any time of those 40 beds are occupied by patients who are admitted, but don't have a bed upstairs. So my 40 bed emerge is automatically down to 20 or 25 beds. It is not uncommon, unfortunately, that 30 to 40 of my beds are occupied, or even 45. And so we're seeing all of our patients in what's supposed to be the fast track area, with attached chairs and maybe a stretcher. And that backs up. You've heard about the ambulance code zeros, and that's because the ambulances can't offload their patients because there's no beds for them, so they're waiting for hours. And you've heard the stories about the waiting rooms. The root problem for all of this is that there aren't enough beds. And physically, there may be beds, but we don't have enough staff. When over the last 2 years, we've lost so many nurses primarily who have left emerge. So we have to close some of those 40 beds because we don't have enough nurses, or who've left the profession altogether. And that leads to long wait times for everybody. And I deal with it, some of it as a doc, but the real brunt of this is being borne by the nurses, especially the triage nurses up front. They're taking verbal abuse from the patients who are waiting hours and hours in the waiting room. They're taking abuse once we finally get them to a bed, but they haven't been seen yet. For some reason, people are a lot friendlier and don't take it out on us doctors. But we see what they say to our nurses, and oftentimes, unfortunately, it's become physical. So we have a workforce that's depleted, a workforce that's demoralized, and we're trying to find a workforce that's leaving. So those are the situations we're dealing with. And then you've got the poor patients, and you've seen some of the numbers that have come up. We talk about in emerge, we don't talk about average wait times because the average can be so skewed. We talk about the 90th percentile. So what experience do 9 out of 10 patients have? And in September, the wait time to be seen by a doctor for 9 out of 10 patients has gone up over 12 hours. That means 10% of our patients are waiting more than 12 hours to be seen just to be seen by the doc. Well, if you're admitted, the 90th percentile wait time is over 45 hours. So you're going to be lying in an emerge stretcher, and 10% of them are going to be lying there for 4 days plus, waiting for a bed upstairs. And the emerge department we're 24/7, so our lights are always on, we're always noisy. It's not a good place to recuperate or rest, which is why a lot of patients are in the emergency department. And the emergency nurses went into emerge to do emergency nursing. They didn't go into it to do inpatient ward nursing, which is an important thing, but very different from emergency. So So we've got patients who are frustrated, family who are frustrated. And unfortunately, we've got a system right now that just says the emerge can take it. The emerge can suck it up. The emerge can handle all of it. I used to say they give us the great compliment of continuing to dump on us because they think we can keep taking it. But we're seeing that we can't. And you're seeing that the what's going on. Not so much at the general, at the civic, we are starting to see some of the pediatric overflow coming in because the emerge, it used to be most people in Ottawa, if you had lived in Ottawa for any length of time, or you knew that if you'd take your kids to CHEO, you'd only come to civic. I'd see a lot of tourists who bring their kids to civic because they don't know about CHEO, or people who don't have an option. And now we're seeing more children at the civic. We do, we do provide decent care, but we're not CHEO. So that is the situation that we're seeing. It was an everyday situation before COVID. With COVID, it's just gotten worse. And with COVID, our efficiency, our productivity, our ability to see patients has slowed down because of all the other things that we have to do with it. It's as bad as in short, it's as bad as you've heard, and sometimes worse. I wish I had a more optimistic view for you. Unfortunately, I see people touting various solutions or so-called solutions that blame the patient or blame the family doctor. Those of you who have family doctors, the family doc, the issue is patients who are admitted and don't have a place. So the fact you couldn't go to your family doctor because of a prescription refill because you don't have a family doc, or you couldn't go to your family doc for a minor issue, but use the air quotes for minor, for a less urgent issue, and that we should be diverting those patients out of the emergency department. That's not going to solve the problem, because the waiting room is not just full of patients with minor cuts and scrapes and non-urgent thing. The waiting room is also full of patients with chest pain, stomach pain, bowel obstruction, terrible headaches that need to be assessed. And if you take the less urgent patients away, you still have all those patients in the waiting room who are getting assessed there. We need more staff. We need more staff urgently. The problem I'm seeing is that all the responses from the government lack the sense of urgency of how bad the situation is now. And I keep thinking something's going to twig to them that it's urgent, whether it's Alex Munter saying we have twice as many emergency patients than we've had, when it's the Alex and the CEO of Sick Kids saying we've had to build a new ICU. I keep waiting for the trigger when people are going to get it. The decision makers are going to get it that this is urgent, this is immediate, and we need help immediately. I thought it might have been when Perth was closed for 3 weeks, Perth Emerge, or when Montfort Emerge closed. You say rural maybe, but how about one in the city? Hopefully it'll be there is no instant solution to a problem that's been 20 years in the making of understaffing. But I think the first thing we could do is we could do our best to get nurses who have recently left to come back by dealing with, as Ona has said, dealing with their working conditions, protecting them from abuse and reacting appropriately if and when abuse happens, by dealing with their working conditions, not forcing them to do double overtime shifts, by repealing the insulting Bill 124. I know I don't mean to speak for the nurses, but as Emerge docs, we're out there advocating that we need emergency nurses. That's where the huge shortage is, immediate shortage is. So we're trying to repeat and reinforce the messages from our nursing colleagues. There are emergency physician shortages as well, but those are going to take longer to recover. And there's shortages out everywhere in the system. We in the Emerge are a symptom of the problems that are occurring everywhere else in the system. This has been, wow, I'm depressing myself now. So I think, Melissa, I am going to cut it off here, and I will leave it open to other discussion or questions.
Thank you so much. You've definitely reiterated what a lot of the other speakers have said tonight. There's definitely a common theme that there's no quick fix, and all the specific working condition issues, Bill 124, et cetera, have all been brought up multiple times. So I think there are a lot of questions in the chat about what can we do right now? What can we do moving forward? What can the unions do as a collective? So I think it's a good chance for Natalie to maybe go into the action plan, and let's talk about what we can do as a collective and what we can do as individuals, and what the plan is to push this agenda along with this government.
Thank you very much. And thank you, Dr. Kapoor. That was really super clear. Didn't you think? Like, it was really clearly explained how the hospital backs up into the Emerge, almost like the canary in the mine shaft, and that the Emerge is sort of, taking all the brunt of all of this, but the capacity issues exist right across the hospital. Thank you for that. And yeah, depressing for sure. But I felt like there were some hopeful things there. There are measures actually that can be taken immediately, that are urgent, that would make a difference. And were it for the political will. And so, as just to say, we have a double job here. One is to force the Ford government to actually finally, for real, do something to improve the situation, like take real action to improve the crisis in the public hospitals. And the second is to stop them from privatizing our public hospitals, right? Which we know they're in the midst of. They're flip sides of the same coin, really. The two things go together: drive the existing system into the ground, create the market for privatization, and then push people into for-profit clinics that are allowed to take the profitable parts of the system for themselves. And that is exactly what we're going to see as this moves forward, unless we stop it. So we have a few suggestions, and we want to hear from you as well. As I said earlier, like, if we don't protest this, if we don't show visible resistance to this crisis, this level of crisis, what do we do? I mean, it just cannot go on like this. There should be people in the streets. I was inspired because in Quebec, the nurses took to the bridges, the big bridges in Montreal, and they called them marches on bridges. And it really captured the imagination of the media actually across the country and all throughout Quebec, and really did put enormous pressure on the government. Now, we always talk about nurses, and I should say, Melissa's an allied health professional. We've got shortages of the allied health professionals, the nurses, and the other health professionals, and the physicians. We've got shortages in long-term care and home care as well, not to not recognize anyone. But could we do something like that in Ottawa? Really visible, protest of some sort. I don't know if there's a good bridge there. I don't think there's a really great spot where people could congregate on a bridge, but I mean, maybe something somewhere very visible that might have kind of a hook like that could capture public attention, capture and inspire the media, that can show visible resistance, and the public can join in. We're also asking, will you sign up? Like, who here among the 100 or so people here right now would sign up to be a defender of public Medicare? and what that means is that you would share a leaflet warning of what the Ford government is doing, not addressing the crisis in the public hospitals and privatizing, you know, in your workplace, door to door on your street, in your seniors groups or faith communities or other, you know, community groups that you're part of, right? Share a leaflet, sign up other people to be Medicare defenders as well. Could we reach 1 million Medicare defenders? That would sure shake up a government. You know, could we distribute the surveys of patients to ask who's being charged in private clinics right now for services that are covered under the Canada Health Act that they shouldn't be paying for, so we can gather the evidence and possibly bring a writ of mandamus to force the Ford government to uphold our own Medicare laws and protect single tier Medicare in this province. So just those things, they're easy. Everyone could do it. And then if there's a protest in your local area, we're asking the Medicare defenders if you would commit to joining it if you can. So like who, just by a show of hands, would be willing to sign up to be a public Medicare defender? And really, it's just a commitment to help with this, spread the word. Like the way that this works is we've got 100 people. We can easily reach 1,000 people, then 2,000 people, and then 10,000 people, and so on. That's what we need to do. Look at that. It's awesome. Thank you. Yay. And then, so from there, would you distribute the surveys, the leaflets? Sala, can you share your screen and show people where they sign up? Because you can do it right now. On our website, we figured this, it got launched today. It's very exciting. And it's going to have a counter so we can count, we can watch the numbers go up. Are you here, Sala? Uh-oh, did we lose Sala? Oh, there he is. Okay. Just a second, sorry. Okay, so this is our website, which, can you scroll up to the top, my dear, so they can see? So it's ontariohealthcoalition.ca. So Ontario, maybe we'll put that in the chat in a second. And if you just scroll down on the website, slowly, Sala. Oh, sorry, slowly. There we are. Defend our public health care. Stop the Ford government from privatizing our public hospitals. And then you just sign up there. And that's it. And then the leaflets and so on, can you show them where they are? Oh, right here on the main page. Stop. Sorry. Become a public Medicare defender. Okay, click there. Okay, there's the leaflet. So you can just print that on a normal piece of paper at home and photocopy it. There's the privatization survey. And then you can print that. We'll fill in the protests. And okay. And this, so everything is there that you would need. Thanks, Sala. That's awesome. So that's just at ontariohealthcoalition.ca, which maybe someone can put in the chat for everyone. So that's what we want to do. And then I just wanted to know, in Ottawa, do you think that we could do something like that, like marches on bridges or something like that with healthcare workers and community members supporting doctors and health professionals and nurses and so on, and community members, but we would need to make it big. Like it can't be a show of weakness. It would need to be a show of strength, right? And we would need to like really show the community that people are furious about this. So what do people think? I just wanted to see if we could have a bit of a discussion about that, and also not to cut people off if they wanted to ask Dr. Kapoor anything while he's here. So now lots of people have their hands up. I think, can we lower them all, or do you have to lower your own hand? I think they eventually lower by themselves, right? They lower by themselves. There we go. They're going. Bye, hands. Or do they not lower by themselves? I thought they did. Anyways.
It stays up until the person lowers her hand.
Oh, it does.
Unless one of the hosts can do that.
So go back to reactions at the bottom of your screen, click on that, and you have to click lower your hand. Thank you very much, though, thanks for being willing. So I'll look for all of you in particular tonight on the website. So what do you think about this? Can you I mean, the main thing is we got to spread the word. We have to show visible resistance. We need to gather the stories and so on so that we can bring a writ of mandamus. We can pour on the political pressure, and we need visible pressure on the government. People need to know that something's happening and have a way to join it, and so that it needs to be visible to them. So I was thinking, could we do something like a big march on a bridge in Ottawa, or something like a bridge if there's no bridge?
Natalie, we do have one comment and question in the chat about the march. The question is, why would we not want to target around a hospital versus a bridge?
Well, we could target around a hospital. I just wanted we could, absolutely. The thing is that to try and make it something a little bit different, but, and also I believe that the 5 unions are planning to do something in the wintertime outside the hospital. So I didn't want to duplicate, but I thought if we could try and do something before the winter break, that would be good, because this has kind of disappeared from the public view. And also because we're in just this unprecedented crisis and nothing is happening. And, presumably if we can rise up, we can actually force something to happen, as we saw, in the education sector sort of over the last few weeks.
We have many people commenting. What about MP or MPP offices, specifically conservative offices? Try to get the information and commitments from them.
Local MPPs?
Yeah, I think that's what people are getting at. I guess the question to you is the point of this to kind of be consistent across the province? So if it's marches on bridges, then people do it across bridges across the whole province, or just different demonstrations of solidarity in support of publicly funded healthcare across the province?
I think it's urgent protest. I think the message is we are in a crisis, an unprecedented crisis, the like of which we've never seen. We're demanding that the government actually take concrete measures to address this problem with the urgency, as Dr. Kapoor was saying, with the urgency that it demands and requires, because people's health and lives, both workers and patients, are at risk. And we demand that you stop doubling the funding for the private clinics and leaving our hospitals to roil in chaos. That's the message. I think it could be anywhere. I don't really want to make the place the debate. If people are willing to do it, wherever you want to do it is fine. I just wanted to package it in a way that media would actually come in Ottawa, that they would see it as something that kind of rises above the noise a little bit. And that's all. And that it's very visible. And the other thing is that if media doesn't come, that people would see it, which obviously over a big highway or something like that, 1 million people will see it, but it's really up to the community. If people are willing to do it, we'll put in the resources and effort to coordinate, and all of that, but we need to know that the commitment is there in the community to do it. And I hope so.
There's lots of people putting up their ideas, so there seems to be interest. People are giving, City Hall, different bridges, 416 around hospitals, MP's offices. There's lots of ideas happening in the chat, and the good news is we're going to keep the chat, so we will have all of that for sure after. So there seems to be some interest from the folks here. A lot of people talking about getting the unions to join together and do this, like what they did with QP, because it will be important to have, solidarity in numbers.
And because we're a coalition, it's the unions and patients and physicians and health professionals. It's everyone, right? For us, for sure. I don't see it is it just me? I don't see the idea.
Yeah, people have been asked to send questions directly to me. I was reading them out.
Okay. So can we try and sort of are there a few ideas that kind of we could test and come to a concrete a proposal on tonight while people are here, just in the last few minutes?
Yeah, we can try. So people have suggested the bridge on Riverside Drive that is right by the Riverside Hospital heading towards the General and Chio. That it would be non-disruptive, but also visible with the parkway underneath and near the hospital. People are saying Mackenzie King Bridge. There's a comment about some of the footbridges over the 417 because it's winter, if you didn't want to be out on a main bridge. There's a lot of comments here about City Hall and Parliament, although not as visible for passers-by, often gets more media attention if you can get enough people.
Okay, so let's take one of those. What do people think about those? Maybe we could get some feedback and start to hone in on one, because I mean, if we're able to, we could do something like around Friday, December the 9th, or Monday, December the 11th, possibly. I mean, this is urgent, right? We need to pull something together, and then we would look to maybe hire an organizer in the community. If anyone knows someone who would be fantastic to help pull it together there and, make it happen. And then would people commit to bringing people out? What do people think about those suggestions? So I heard the bridge by Riverside Drive. Does it have a sidewalk?
There's a sidewalk on both sides, and there's kind of a buffer bike lane, and then there's the driving lanes.
Oh, okay.
Yeah.
So is that a good one? The bridge by Riverside Drive? I do not know this. Ottawa people, what do you all think?
I think that's probably the safest and probably most visible. It's right near the Riverside Hospital, which is an outpatient facility.
Yeah.
And there is a road that a highway that goes underneath it. I mean, if we were going to do a bridge, yeah.
What there isn't, though, in that area is parking for anybody coming from around the city.
I agree. That's the problem with the bridge thing in Ottawa is that I don't know where you would park. I agree.
So the Mackenzie King Bridge, is that better for parking? Is it equally safe? No.
I don't think
So
so.
it would be just as bad, if not worse.
Yeah.
And
I think collecting people, for instance, at Confederation Park, which is across the street from City Hall and the courthouse.
Does the Ministry of Health have offices in Ottawa? Because that's where I would go.
That's a good idea. Ministry of Health, though, I think, isn't that out at Tunney's Pasture?
it's also federal, and the target here is.
No, the Provincial Ministry of Health.
Oh.
I don't think so. Anybody else know?
I would be very surprised if they don't, because I've been to offices of theirs, but not in the last couple of years when I needed to use equipment.
I just wondered something though. You were just saying, Catherine, if people collect where and then march over to the bridge?
Well, there are parking garages and whatnot, not far, and there's one under City Hall. There's a park called Confederation Park. It's across the street. It's people could collect there. I don't know. I'm just thinking out loud here whether where the march would go to. Not sure.
Can it go to the Riverside Bridge, or is that too far away?
No, it's too far away.
Is there anywhere close to that bridge?
No, there is an Ontario. There is an OHIP office on Laurier.
Oh yes, that's true.
What they're saying about bridges, they are very difficult to get to and to park around.
Yeah.
In Ottawa, so I don't think. I mean, I think it's interesting, but I don't think it would be a good idea here. I think some place close to a building where there's more available parking and preferably available to OC Transpo would be useful as well.
Natalie, there's a lot of comments in the chat about City Hall and how there is parking at City Hall and how there's lots of traffic, especially if you're there during rush hour going to downtown or leaving downtown. There's also comments about would it be possible to arrange buses from a parking space to a bridge if that was the final decision.
What if we were to do City Hall, but march out of that little street, whatever is it, Carla or whatever it's on, over
Elgin.
to Elgin and then down and, you know, down, what is it, Rito or whatever, somewhere where it would be visible, right? To
You mean
people?
going up towards Parliament Hill?
Yeah, or just somewhere where there's a lot of traffic.
Hmm.
Does that make sense? Is that because gathering at City, there's all kinds of people with their hands up. Sorry, I'll hear from you.
That's okay. I just am going to make one more comment and then we'll go to the people that have their hands up. There's a question about could we park around City Hall, and there is that bridge right by the Chateau Laurier right by City Hall. It does go over the parkway and the water. So you'd still have your march on the bridge, but then there would be parking options from City Hall just kind of around that corner over that little bridge. So that's an option too, but I'm curious to hear what people who have their hands up say. So Louise?
I don't know why, if our intention is to disrupt and get attention, why don't we do a slow drive on the 417? And we could label it something like, if you think it's frustrating to wait an hour to get across the city, imagine waiting 18 hours with a crying baby.
That's a good idea. You're subversive.
All along I was waiting for something radical, but then like, oh, wow, that's really radical.
Okay, I think there's Simone and then Pam.
Yeah.
See what people think.
Hi there, just it's Kevin Scarrett and Simone Powell here, just to throw in a slightly different thought or option for an Ottawa action. I believe that we are home to offices of at least one or two of the significant private healthcare providers, like private lab companies. There's executive health, private healthcare companies that are, part of the machinery that's seeking to privatize healthcare and benefit from this. But this is something that's not very visible and not very well known. I kind of like the idea of if the theme of this is the crisis engineered by the Ford government for the benefit of these kinds of companies. I just thought I'd throw that into the mix. I haven't got one right in mind, but I think we could maybe have some discussion about a target that way, because I think it makes the location itself political.
Thank you.
Yeah, that's an idea.
And Pam, sorry, my phone was
Yes, now can you hear me? So I would just like to say I'm very interested in this meeting. I'm very interested in your cause. I kind of came across it by accident though. And so my question, not to put a damper on anything, because there's some great ideas here, but do you have enough people rallied yet? Because one of the comments I heard earlier, which I really believe is important, is that you have enough people to make a statement. And you have a meeting here that really is not overwhelming in terms of the number of attendants. And that these kinds of things always shock me. There are millions of people in this province that are significantly affected by what's going on in healthcare. And there's 100 people that show up, and it just flabbergasts me. So I'm saying, how can we rally the troops before we actually take the troops out? Because 100 people showing up somewhere is not going to attract attention. And so I go back to those kinds of questions, is how do we get, I personally think so many people in this province they don't understand that things can be better. It's like a complacency. It's like an acceptance of, oh, healthcare is falling apart. And that's the end of the conversation instead of the beginning of one. And that distresses me as well. You can tell I'm very animated by all of this because I'm a senior who needs healthcare. But I'm not the only one. There's millions of us. Where are you guys? So how do we get the rallying force and then perhaps even have a coalition of cities across Ontario rather than just Ottawa? If you had several cities, same day, same time, same locations, I think it could have a much bigger impact. And I'm not saying I know how to do all that, but I'm just worried that you're such a small group right now that you'll get lost in the shuffle of so many other things. Sorry.
Thank you, Pam. Don't be sorry at all. All conversation is good conversation in a think tank, right? We will definitely take that back. And I think that we agree with you that we need to make sure we have good, strong numbers. And we are having these meetings across the entire province. This isn't the only one for the province. Let's go to Ruth, and then I'm being mindful of time, and we wanted to really finish by 9 o'clock. We'll take Ruth's comment, and then we will make sure that we capture everyone's ideas for our plan going forward.
So there's a couple of things. First off, I would ditto everything that Pam said, because I don't think we'll get the impact that we're looking for if we don't have the numbers. And if in some way, shape or form, we need to be a pain in the ass, pardon my language, but if you want to get their attention in some way, we've got to hit them where they can't ignore it and they can't dismiss it, if that makes sense. So part of that is about messaging and optics. Part of that is about numbers. And if you look at what the education workers did, where they had the marches on Queen's Park with all of the unions and, you know, the turnout that came out for that, is there a way that we can leverage the issues that the education workers had around underfunding, the issues around long-term care and underfunding? My dad's in long-term care. The core funding is actually this year lower for 2023 than it was pre-pandemic. So all the stuff that Doug Ford has said about fixing long-term care, it's not happening. And so there's a whole group of different sectors that are all negatively affected. So I would say, let's see what we can do to coordinate between the groups that all have, they all have skin in the game in this, and see if there's a way of doing that. The other thing, I did do a lookup, and there is a Ministry of Health office in Ottawa. It's at 2380 Saint Laurent. So if we wanted that, it is actually one, but it's not in downtown.
So if I can just jump in, Melissa, we are actually organizing coordinated events across Ontario, and yours is the first town hall meeting. So I wanted to get ideas from here to go on. If people in Ottawa don't want to do it or don't think you have the numbers or whatever, we'll go somewhere else. I was hoping that people would actually try. You'd be willing to try to get people out because of the urgency and because if we don't do it, who else is going to do it? I think we can do it. I would like to see us try to do it. And Ottawa is a massive city. It's hard sometimes to advertise and so on effectively in Ottawa. But I think if we have 100 people willing to put some effort into it, the chance of us actually getting a sizable group together, I think is very significant. And we have done, literally hundreds of these, maybe thousands over the years. So if I just want to get a sense from people, whether some people are willing, it sounded like people were willing to till just now. Now it sounds no.
No,
So
I think
I just want to get that sense.
you're misunderstanding.
Sorry, just a
Natalie.
second, Ruth, thanks. So I just want to get a sense from others. Are you willing to do it? Could we do something around the 9th or the 11th and then figure out where to put it? And then we can wrap up with a decision kind of whether or not we're going to go forward with that in Ottawa, if that's good.
So just Natalie, I think you misunderstood both Pam and I. I didn't hear Pam saying she wasn't willing, and I'm certainly willing. It's that I just want to know that we're coordinating it enough to have the impact that we want and that the planning is there. That's all we're saying. And I'm speaking for Pam. I'm not 100% sure, but that was what I heard from her was let's make sure that when we do this, that that they can't ignore us.
That's absolutely what I'm saying. In fact, I've already signed up, so I'm
Yeah,
definitely
no, I
committed.
just, it's all good. I just wanted to make sure from others if that we're not just, we've not gone on a different track.
We are getting some people saying, yes, we can do it. Yes, we need to try for this in the chat. We do have people with their hands up. I'm assuming the hands up are a yes, we're interested in doing this. So
I think they want to comment, some of them.
yeah, we are running out of time, and at the will of the group, we can take a few more comments. So I don't know, Rachel, did you want to comment on this?
It's funny that you're talking about bridges because we've actually just broached it in a meeting before this one for ONA. And we're hoping to actually do a silent bridge and not chant and just stand there with signs and hopefully get other unions involved. But we literally just broached the subject today. Now we're looking at more in the new year because we've got a lot of other stuff going on with OR assistants in Hamilton Health Sciences and here at TOH. So we've got those campaigns to run first because we don't want OR assistants in our ORs. But that's definitely something that we are looking at doing in the new year or early spring.
Thank you, Rachel. Eleanor?
Looking at those that are on the screen, not like me hiding behind my initial. We're the seniors that are concerned, and how do you get the younger generation to see what's going to happen to their parents or themselves? And it's a desperate situation right now. I wondered if other areas in Ontario where, yes, they want to do something, if a march or a demonstration in Toronto and buses from these areas. When there's a demonstration at Queen's Park, it gets coverage, and if it's a small demonstration on some bridge or somewhere, it may get some news. What I think is going to happen is if CHEO continues with the terrific numbers that they have, that will get publicity. Children are everybody in this concerned about children's health, and if they're ill. Seniors' attitude is, and I feel that many times, ageism, knock you down on the street, walking with the three abreast. So my thought maybe is the Queen's Park and a big demonstration, but it has to have some focus on why. Like the teachers had a very good, or not the teachers, the low income education workers. That shocked people. I know many said to me, 39,000, that's all they're earning? They were stunned. There's got to be something that will, the nurses that haven't had a decent raise in years. The PSW's got an increase but it created problems internally, I think, between other staff. I'm looking or trying to think of what is the magic maybe it is magic, and that will trigger people all ages to get on the bandwagon and fight for better health care. And by the way, what millions, I think, that the Ontario government didn't spend. I mean, that's a disgrace, and it didn't get much coverage. A surplus? And like in the Ontario budget, when there were people dying in long-term care homes. Sorry, I'm venting.
Don't be sorry, because we're all thinking the same thing. That surplus was something else, wasn't it? We have 9 minutes left. So we have Elaine and Angela left to speak. If you have thoughts on whether we should do this march, whether we have the capacity to do this march, and maybe some ideas, and then we will wrap up. So Elaine, go ahead.
I'd love to say that I think we can gather a lot of people together. All we have to do is beat the drums. And for example, I don't see a representative of the Ottawa Labour Council, but that's the first agency we should appeal to put out the word on a broad base. And also, having been to many protests and demonstrations in Ottawa, I think we couldn't do better than to use the City Hall parking and gather around the Human Rights Memorial. Was anybody else at the Pussy March, the first one and even the second one? They were absolutely fabulous. They just filled the streets. So it can be done, and that would be a very effective place to do it. Thank you.
Thank you, Elaine. Yes, Sean McKenney from the Labour Council was on here, and we do have the Cornwall Labour Council as well on here tonight. So they are they're listening and they're aware, and I'm sure that they're ready to hit the ground running to help as well. We also have multiple unions represented here, which is fantastic. I see no more hands up at this point. Someone did have their hand up and it's now gone down. So it sounds, Natalie, to me like there is interest in trying to rally the troops for this march for Ottawa. Oh, someone else commented that the Renfrew Labour Council is also on here tonight. So we do have quite a good representation from across Ottawa and beyond tonight. So it sounds like people are interested in doing a march or some sort of action, and maybe we can take all the comments in the chat. People have put their information in there looking to help as well. So it sounds like there might be some interest. So maybe we can take that back and connect with the labor councils that are here and the unions that are here and see what we can do with that.
And the community groups, like we're both, right? We're like, there's labor, and then there's all of the seniors organizations, the community groups, the health professionals, the broad base of the coalition. So we need to work with everyone. I think what we'll do is, because it's Monday and we need to get this sort of sorted, in the next 2 days, we'll come up with an actual plan and send it out to everyone. Okay, if that's good. It sounds like we've got to go ahead. Okay, thanks, Melissa. Sorry.
No problem. So I will just wrap up by thanking everyone, all of our speakers, and everyone who has participated. Thank you, everyone, for coming out. I also want to let people know that we do have monthly meetings at the Ottawa Health Coalition branch. It is the third Monday of every month. So if you are interested in keeping up to date on what we're doing, what comes next, please join us on the third Monday of the month. Our next meeting will take place in January, because the third Monday ends up falling right at Christmas this year in December. So our next meeting will be in January, but it sounds like Natalie will be sending something out on what's to come out of this meeting. And if you aren't a member of the Ontario Health Coalition, please consider joining on the website. The link to the petitions are still in the chat. And the Ottawa Health Coalition specific branch, you can reach out to us at Ottawa Health co@gmail.com if you are interested in joining our meetings or becoming a member at the Ottawa Health Coalition. There was also a comment in the chat about we should have a GoFundMe for any sort of ads, but if anyone is interested in donating to the Ontario Health Coalition, you can do that on the website as well. If you think this is a cause you want to get behind, it is fully donation funded. So please, if you are looking to donate or raise any funds to further Natalie's mission in Ontario and all of our mission in Ontario, then you can absolutely donate to the Ontario Health Coalition.
Thank you to the Ottawa Health Coalition. Like, you are amazing. That team, I see you out there, Betty, Catherine, Nancy, Mary Catherine, Melissa. I don't know who I'm missing here. I'm just looking at my screen, but thank you Rachel. Thank you so much, all of you, for your hard work and dedication. You're community heroes, all of you. Thank you. Yay.
Thank you so much, everyone.
I hate Zooms because you can't hear the applause.
Have a great night, everyone. Stay warm.
Thank you.
Bye.